I'm going to conduct a mental health exam. Do I have your permission to conduct this interview with you?
Yes.
Okay. Hi, my name is Brenda. I'll be your student nurse for today. And right now I'm going to perform a physical assessment on you, which is one of the beginning steps of making sure we get a physical assessment before the mental eval. So I'm going to check her blood pressure. You're gonna bend your wrist, hold this right there. Could I see a finger on your hand, please? And I'm also going to check her temperature. Head up for me. I have her temperature. I have her pulse ox. She is breathing in room air at 99%. Does that stop here? Her blood pressure is 131/84. I'm going to assess her eyes for perla. Can you see this pen light? Can you follow this pen light for me? Her eyes are at 4 mm. I'm going to listen to your heart sounds and your lung sounds. Can you take a deep breath for me? And listen to her stomach for bowel sounds. There is a S1 and S2 present. She has active bowel sounds in all quadrants. Can you lean forward a little bit for me? Alright, I'm going to check her range of motion and reflexes. Can you lift your arms up for me? Can you squeeze my fingers as hard as you can? Okay, you're gonna let go. Hold my hand for a second. Can you pull against my hands towards you? Alright, let go. Can you lift your feet up for me? Can you push against my hands? Can you pull against my hands? Alright, we're gonna check her fetal pulses. Alright, could I see your arm, please? Checking her radial pulse while assessing her respirations. Respirations are at 19. Her pulse is at 87. I'm gonna pinch her skin just a little. She has elasticity in her arm. Her skin is not dry. Gonna check her cap refill on her finger. She has cap refill at 3 seconds. Her nails are short as if she's been biting them. Could I see this hand as well? Alright. Assessing her hair and scalp, it's free of lesions. A little bit of hair gel that could have looked like dandruff. Her eyes are symmetrical. Can you hold your head up for me? Can you take a deep breath? Her nails are patent. Could you stick your tongue out for me? Her tongue is pink and moist. Can you say I need to see the back of your mouth like your tonsils. Her tonsils are intact. She has all of her teeth inside of her mouth. So no decay, no dentures are there. Can you hear me very well? Can you plug up one of your earlobes? Can you hear me?
Yeah.
So at this moment, I am going to perform her mental status report. Are you experiencing any pain today?
No.
I'm going to have to So I have just a few questions that I would like to ask you. If you feel uncomfortable at any moment, let me know and we can stop it. So I am assessing her appearance. Her hair is clean. Her clothing are intact. Her teeth is in good repair. She's neatly dressed. She's sitting in an erect position to where her posture is not slumped over. Her behavior is very cooperative. She's not hostile or acting suspicious. Her level of awareness, she is conscious and awake. And her attention span seems to be intact and she's able to focus on my questions. Could you tell me your name?
Farmer.
All right. Where are we right now?
In my house.
Okay. Can you tell me what the day and the date are?
Friday, 04/16/2021.
All right. So she would be orientated ×3. So I'm going to now ask you about your thinking and your thought process. What is a daily routine that you do?
Get up, get dressed, brush my teeth, and do my hair, and then go to school.
Okay. I'm going to recite 5 things to you right now, and I'll ask you about them in about 5 more minutes. This is basically to assess her short-term or recent memory. Can you try to remember these 5 things? I have apple, pie, chair, lamp, and shoe. All right. Do you remember where you were born?
Arkansas, Little Rock.
Okay. Do you know what middle school you attended?
Bryan Middle School.
Okay. Do you know what year your youngest sibling was born in?
2007.
Alright. So her long-term memory is intact. And her speech ability and able to communicate with me is coherent. She uses appropriate words. She has a normal rate of speech. Her volume is not too soft. It's quite normal. She doesn't stutter or repeat words. So I have a question. How are you feeling today? Are you happy, sad, angry?
Happy.
All right. So her mood is appropriate for her emotional condition. Her body language matches that of being a happy person. She is making eye contact with me. No voice changes are present. It's appropriate. It doesn't sound flat or she doesn't sound overexcited. The next thing I would like to ask you is, do you ever think of harming yourself or others? Have you ever thought about suicide? The next thing I'm going to go with is asking you questions about your abstract thinking and your judgment. So I have a question. If you found a letter on the ground in front of a mailbox, what would you do with it?
Pick it up and put on the mailbox.
Alright. And I'm going to ask you to repeat those 5 words for me.
Apple, pie, chair, lamp, shoe.
Good. Well, her recent memory is intact. She was able to repeat all 5 of those words back to me. And in the same order that I gave them to her. I'm going to also test your abstract thinking again. What does this mean to you when I ask you this question? People in glass houses should not throw stones. What do you think that means? There's no right or wrong answer.
They shouldn't act like they better than everybody else.
Alright. She gave me an abstract idea with that, so we're gonna go with abstract thinking. My next thing that I would like to test you on is your perception, where I will test all 5 of your senses. And what we have today is an orange. And this test will be quick and simple. Could you place this in your hand? My question is, can you feel it?
Yeah.
What does it feel like in your hand?
Cold.
Cold. Let's see. What shape is it?
Circle.
Do you know what color it is?
Orange.
Okay. Can you clearly hear me asking you these questions?
Yes.
Okay. Could I see that orange for a second? I will then cut this orange in half. And I will give you half of it. Can you smell that? Can you smell the orange?
Yes.
Now, if I ask you to lick it, could you lick it and tell me if you taste it?
Sour.
But can you taste it?
Yes.
So all 5 of her senses are intact. She can hear, she can see, she can taste, she can smell, and she can also feel. So her perception is quite together. That would conclude me doing a mental status evaluation on you. I would further these results to a doctor, and the doctor will be able to get back to you to tell you what he came up with, alright? Alright, thank you guys. This is Brenda. And I hope you like it. I hope you like it.